Hello students, today we will discuss about the osteology of sacrum. In today's lecture, we will only talk about the important features of this bone. In the coming part of this lecture, we will talk about the attachments and the structures passing through the different foraminas of this bone. So let's discuss this bone. As you know that sacrum is a large flattened triangular bone. Now when you will see the vertebral column, you will find that the sacrum is the lowermost part of the vertebral column, and this is your triangular shaped bone which is larger in size. Now this is actually formed by the fusion of 5 sacral vertebrae. Now when you will have the comparison between the number of the bones of a newborn and the adult, you will find that the bones will decrease in the number from fetal life to the adult life. Now why? Because the bones undergoes the fusion. So that fusion between the bones is responsible to decrease the number of bones in adult. One of the example is that the 5 sacral vertebrae become a single vertebrae or a single bone. It forms the posterior-superior aspect of your bony pelvis. Now you know that the pelvis is consist of the 3 bones. Now these are the 2 side by placed hip bones, and posteriorly you have a triangular sacrum. Now when you will see the placement, it is not only the posterior side but in the upper part of the pelvis. So posteriorly in lower part of the pelvis you don't have the bone. So the sacrum is occupying the posterior but the superior part of the pelvis. Now this sacrum articulates on either side with the corresponding hip bone at sacroiliac joint. So this is the sacroiliac joint, and this is actually the junction between the sacrum and the hip bone. The upper part of the sacrum is massive because it supports the body weight and transmit the weight to the hip bone. So when you will see the structure of the sacrum, you will realize that it is having more density, more bony mass in the upper part, particularly in the area which is going to make the joint with the hip bone. The reason is that this upper part of your sacrum is going to take part in the weight transmission from the sacrum or vertebral column to the hip bone, and from the hip bone the weight then will go to your lower limbs, and from the lower limbs it will go towards the ground. So when you will see the structure of the sacrum, you have this question in exam sometimes, that why the upper part is so much dense or massive? Because it is responsible for the weight transmission. The lower part is free from the weight, that's why it tapers downward. Clear? Now when you will see the presenting parts of the sacrum, sacrum is having a base, a apex, and the 4 surfaces. So whenever you are talking about a triangle, the triangle is having a base and the apex. So it is an inverted triangle. So you are able to see that this is your base, which is in the upper part going to make a joint with the vertebrae of L5. This is the apex, and these are the anterior surface. This is the dorsal surface and 2 lateral sides of this bone. The pelvic surface or the ventral surface or the anterior surface is smooth and it is concave. So when you will see this bone, you will realize that this surface is smooth and it is concave. The dorsal surface is rough or irregular and it is convex. So this dorsal surface is convex and it is rough. Apart from that, it is have right and left lateral surfaces where you have the irregular and articular area, and this articular area is going to make joint with the hip bone. Now in this video clip you can see the all areas of your hip bone. So this is your ventral surface or the anterior surface. This is your superior or the base of your bone. This is the apex or the lower end of the bone. and these are the two lateral surface. This is the lateral side of your right area, this is the dorsal surface, and this is the lateral side of your left area. Clear? So when you will rotate this bone from all around, you will find that it is having the anteriorly placed ventral surface, posteriorly you have the dorsal surface. Dorsal surface is having the projections which will make it rough, while the ventral surface is concave and the posterior or dorsal surface is convex. Now we will see the parts of the body of your sacrum. If you will see the sacrum, you will divide the sacrum into the two major areas, the midline and the lateral masses. And what is the line of demarcation? It is divided by the rows of the foraminas, which are known as ventral and dorsal foramina. Now on this bone, you can see that these are the foraminas on the ventral surface, so they are known as ventral sacral foramina, and you have the foramina on the dorsal surface which are known as dorsal sacral foramina. And if you will pass a line from this dorsal ventral sacral foramina, we will divide this whole bone in the three parts. One is this central or midline or the median segment of the bone, and the lateral masses of your sacrum. So lateral mass is present on both the sides, while this median portion is present between the sacral foramina. Now this is the superior view or the base, where you can see that this is your midline portion and these are the two lateral masses of the sacrum. Clear? So the lateral mass formed by the fusion of transverse processes posteriorly and the costal elements anteriorly, and this median portion is containing the sacral canal. So here you can see that this is the sacral canal, and this sacral canal is a feature of your posterior part. So on the posterior side of the bodies of these sacral vertebrae, you will find a canal in the midline. So the sacral canal becomes the part of this median portion of the sacrum. Now when you will see the lateral mass is made up of two parts. It is having the transverse component and it is having the costal component. Now what is the meaning of the transverse component and costal component? Now when you will see a vertebrae, you know that the vertebrae are having a pair of transverse processes. So suppose this is your vertebral and this vertebrae is having the two transverse processes. This is the vertebral canal. Now this vertebral canal convert into the sacral canal. Now here when you will have the rib is going to articulate like this. Now what will happen when the fusion is taking place with the rib, with the adjacent sacral vertebrae? What will happen? That these transverse processes merge with each other and every vertebrae is having the costal element. But what will happen in the human beings, that the costal elements of thoracic region convert into the true ribs. Remaining costal elements of each and every vertebrae become the part of the vertebrae itself. So for that you can go and watch my video of the vertebrae, and in that video you will realize that every vertebrae is having the costal element and transverse process element. But the costal element of the thoracic region only comes out and convert into a complete rib. So when you will see a thoracic vertebrae, you will not have the costal element because the costal elements are forming independent ribs. But in the cervical region, lumbar region, sacral region, these costal elements are become the part of your vertebrae. So the important thing again is that the vertebrae is always present on anterior aspect of the transverse process. That means if you will see the cervical vertebrae, you will have the intervertebral, you have the foramen transversarium. So this anterior part of the foramen transversarium is representing the costal element, not the posterior part. Because here you can see that ribs are also always present on anterior aspect of transverse process. So you have to understand this concept that whenever you are having any rib, they are present in the T1 to T12 area, but apart from in the upper cervical, lower in the lumbar region and sacral region, there is no individual rib. That means the costal elements become the part of the rib. Sometimes you know that the costal element of 7th cervical vertebrae develops independently, then it is known as cervical rib. That means the rib can develop from any of the vertebrae if the costal element of that vertebrae detach from the vertebrae. Clear? So here also you have to understand that this is your ventral part. So this ventral part of the lateral mass is actually represent the costal element, while the dorsal part of the lateral mass represent the merge transverse processes, and later on both the costal and the transverse process elements merge with each other to form this lateral masses of your sacrum. Clear? So when you are reading the sacrum, you are talking about the fusion of 5 sacral vertebrae, and along with the bodies, the transverse processes are also fusing with each other along with the costal elements of those respective sacral vertebrae. So when you will see the central part of the sacrum, it is formed by the fused bodies, pedicles, laminae, articular processes, spinous processes of 5 sacral vertebrae. So this central area is actually formed by the fusion of the bodies of the respective sacral vertebrae. Along with that, posteriorly you have the pedicles, laminae. So you know that what is pedicle. So when you will have the body, from the body you are having a small projections, and these are known as pedicles. From the pedicles you are having the lamina, and between them you have the vertebral canal, and posterior to the lamina you are having the process which is known as spinous process. So this portion is this area is forming the central part of your sacrum. The medial part of the sacrum consists of the median and intermediate sacral crest. So my dear students, this is again the question of your exam. We will see that there are 3 types of the crest: median, intermediate and lateral sacral crest. But the median and intermediate sacral crests are the part of the central portion of the median surface. Why median component? Because the median sacral crest actually represents the spine, and you can see that spinous process are the part of your central area. Along with that, the intermediate sacral crest is actually represented by the articular processes, and here you can see that articular processes are again the part of the median or the central portion of the sacrum. So sometimes you have this question in exam, that which of the following sacral crest is not the part of the median component. Why? Because the median and intermediate sacral crest are actually formed by the 2 parts of a typical vertebrae. What they are? Spinous process, which is going to form the median sacral crest, and articular processes which are going to form intermediate sacral crest. The lateral sacral crests are formed by the transverse processes, and transverse process is not in this list. Now apart from that, you have the promontory, superior articular process and the transverse ridges, which will have the another 2 very important features: sacral canal and sacral hiatus. So when you will see this midline portion, you will find the sacral promontory. Now what is sacral promontory? Now this border of the anterior placement, this anterior border of your S1 vertebrae is known as sacral promontory. Now posteriorly, when you will see the sacrum, you will find the sacral canal which will open into the sacral hiatus. And what is the transverse ridges? So transverse ridges are here, and these transverse ridges actually present the site of the fusion of vertebral bodies. Now what about the lateral part of the sacrum? As initially I already told you that lateral mass of the sacrum is actually formed by the fusion of costal element and transverse processes. So it is a large projection that extends from the side of the medial part. The transverse processes extends from the side of the sacral vertebrae as a individual bony bar initially, but later on what will happen that these transverse processes fused at their lateral end form the anterior and posterior sacral foramina. So what will happen that these lateral masses are actually formed by the fusion of your transverse and costal elements, and that's why the division of the foramina will there, and you have the ventral and dorsal foramina. So we will see the detail of these foramina, how they will form in the coming slide. So on the pelvic surface, if you will see, this is the pelvic surface of the sacrum. The bony bars between the foramina represent the costal element. So these are the bony bars on the pelvic surface. Now these bony bars are actually representing the costal element. As I already told you that costal elements are always present on the anterior side of the transverse element. Why? Because if you will see your chest wall, you will realize that the ribs are articulated on the anterior side of the transverse process. So the rib is actually the representation of the costal element. So this part of your ventral surface of the sacrum between the adjacent sacral foraminas are represented by the costal element. Lateral to the foramina, the costal elements unite with each other and with the transverse process. So this portion is actually a mixed area, and in this area you are not only having the transverse processes, but you are also receiving the ends of the costal elements. Those will go here and merge with your transverse processes. Clear? So my dear students, you have to understand this concept that every vertebrae in the body is having the costal as well as transverse process elements, and in case of the thoracic region, the costal elements convert into the individual rib. That's why the thoracic vertebrae are not having the costal element. In the remaining cervical, thoracic and sacral region, the costal elements are always there, and those costal elements become the part of transverse processes. In case of the sacrum, the lateral mass is actually representing the fused costal elements and transverse processes of the sacral vertebrae. Clear? Now, in these two superior views, this is the superior view where you can see that this is your dorsal side, this is your ventral side, this is your sacral canal, and if you will see, we can divide it into the three parts. This is your articular process. So from the articular process posteriorly, if you will go anteriorly, this will become the central portion. These are the two lateral masses, and on this lateral masses, this will become your costal element ventrally, and these are the transverse element, and they merge with each other, and because of their fusion, we are having the lateral mass. Clear? Now this is what is the section. Now we took the section of sacrum at the level of S3. Now if this is one of the example for just for understanding purpose, I took the section of the sacrum at the S3, and you are seeing from the inferior side. Now when you will see the inferior side, you will realize that this is your sacral canal. Now from the sacral canal, you can see that these are the intervertebral foraminas, and you will see later on that through these intervertebral foraminas, the sacral nerve will come out, and then the sacral nerve will divide into the posterior and ventral rami. and these posterior rami goes posteriorly and comes out through the posterior sacral foramina, and this ventral rami comes anteriorly and come out with the through the ventral sacral foramina. That means these foraminas are ultimately communicating with the sacral canal through this intervertebral foramina, and the intervertebral foramina is not visible on the outer surface. Clear? What you are able to see on the outer surface? Ventral and dorsal sacral foramina, not this intervertebral foramen. Clear? And here you have to understand that this anterior bar between the adjacent ventral sacral foramina are represented by the costal elements. Now, if you will see this video clip, what you are able to understand that this is the dorsal surface of the sacrum. We have just cut the sacrum at the level of third sacral foramina. Now, you are seeing the sacrum from the lower side. Now, when you are seeing the sacrum from the lower side, you have to first check that this is your sacral canal. Now, on the sides, this is your dorsal sacral foramina and this is ventral sacral foramina. And here, if you are able to appreciate the placement of intervertebral foramina, so you will find there is a very small communication is there. Now, this channel is actually the site of intervertebral foramina. So, with the help of these intervertebral foramina, the dorsal and ventral sacral foramina communicate to the sacral canal. Clear? Now, here you can see the exit of the nerve. So, again you can see that this is your sacral canal. Now, from the sacral canal you can see that this nerve is coming out. So, this is the site of your intervertebral foramen, and as soon as the nerve is coming out, it is dividing into the dorsal rami and ventral rami. And you can see that this ventral rami is passing through this ventral sacral foramen, and this dorsal rami is going posteriorly through the dorsal sacral foramen. And also you can appreciate that at the site of this intervertebral foramen, you will find the position of dorsal root ganglia. So, here it is the dorsal root ganglia. Clear? So, this should be very clear in your mind that the sacral canal is communicating with the dorsal and ventral sacral foramina through the intervertebral foramina, and these ventral and dorsal sacral foramina opens on the adjacent surface, and this part of the bony bar between the ventral sacral foramina represent the costal elements. Now, what is the anatomic position of this bone? So, the pelvic surface but obviously faces forward, but it should be downward in direction. And how much downward? It make an angle of 30 degree. Now, which part of the sacrum is making an angle of 30 degrees? So, when you will hold it, this is the superior surface. So, superior surface is having this type of the direction. It is not straight, it is not horizontal, and it make a angle with the horizontal plane, and this angle is 30 degree. So, this angle of 30 degree is giving this bone anatomical position. So, this is the superior surface of your sacrum, and this is the horizontal plane, and the angle value is 30 degree. The upper end of the sacral canal is directed almost directly upward and slightly backward. Now, in this image, you can see that when you are holding the sacrum in anatomical position, actually the sacrum is not an individual bone, it is always a part of the pelvis. So, when we are putting the pelvis in anatomical position, the sacrum automatically comes in the anatomical position. So, and when you are putting the pelvis in anatomical position, actually we are talking about the anatomical position of the hip bone. So, in such a way, these all three bones are interconnected in terms of anatomical position. So, when you will bring the hip bone in the anatomical position, both sides, the pelvis will automatically comes in the anatomical position. Clear? Now, in this image, you can see that this is your sacral curvature, and this sacral curvature is having anterior concavity. So, and this angle is around 30 degree with the horizontal plane. So, these are few points about the anatomical position. Now, what are the features of the base? So, base we have seen that it is directed upward and forwards. It formed by the upper surface of the sacral first vertebrae. The body is lumbar in type, clear, and it articulates with the lower or inferior articular processes of L5 on the side and its body in the midline, and that is known as lumbosacral joint. The projection or the anterior margin is known as sacral promontory. So, this is again the question of your exam. Where is the sacral promontory? So, this anterior border of the body of S1 is known as sacral promontory. Now, what are the other features? The pedicles are short. You know what is pedicle? Pedicle is present posteriorly, and this is a connection with the body and the articular process. So, this is what is actually the small area is known as pedicle. So, pedicles are very short. Then you will have the laminae. Laminas are obliquely placed, and this part is known as lamina. So, these are the laminas. So, pedicles are very short as compared to the lamina. Then you will have the spine form the first spinous tubercle. So, on the base, this is the spine of the S1, and this spine of S1 persists as a first spinous tubercle. The superior articular processes projects upward. That we already seen that it is going to make a joint with the inferior articular process of L5. The facets of them are directed backward and medially, which is again the characteristic of lumbar vertebrae. So, these are the lumbar type. The transverse process are highly modified. So, that I already discussed that each process is massive and fused with the corresponding costal elements, which I have already told you that every vertebrae are having the costal elements, and in case of the sacrum, these lateral masses are actually the fused part of the transverse and your costal element. So, here you can see that this is your costal element and this is your transverse element. So, that's why you have the massive lateral part which also take part in the weight transmission. Now, what is the ala of sacrum? So, the base of the anterior mass, lateral mass forms a broad slope surface, and it is like a spreading fan wise area which forms the side of the body, and this is known as ala of sacrum. So, in this image, where is the ala? So, these fan shape like area are known as ala of the sacrum. So, this is the ala of the sacrum which is placed on both the side of your sacrum. Clear? Now, the ala of sacrum is subdivided into a smooth medial part and the rough lateral part. So, here you can see that this roughness is present on the lateral aspect, while this medial surface of the ala is comparatively smooth. What is the apex? Now, apex of the triangle is facing downwards here, and it is formed by actually the inferior surface of the S5. And this inferior point of the S5 is going to make a joint with the coccyx, and that is known as sacrococcygeal joint. And here you can see in this image that this is your coccyx and this is your apex, which is making a joint, and this joint is known as sacrococcygeal joint. Now, what about the pelvic surface of the sacrum? Now, we have seen that the pelvic surface is concave, it is directed downwards and forwards. Apart from that, the pelvic surface is having the transverse ridges, and these transverse ridges indicate the line of the fusion of adjacent sacral vertebrae. So, here you can see that these are the lines. So, there are 4 lines because you have the 5 sacral vertebrae. This is S1, 2, 3, 4, 5. Sometimes you also have one more vertebrae attached here. In that case, it has to be the L5. Clear? These ridges That means the transverse ridges end on either side at the 4 pelvic sacral foraminas which communicate with the sacral canal. So you can see that the level of the transverse ridges is fixed. It is always at the level of the ventral sacral foramina. So if you will trace the transverse ridge laterally, you will find that both the side you will find ventral sacral foramina. Now what about the dorsal surface? The dorsal surface of the sacrum is rough, irregular and convex. Clear? That it is directed backwards, that we have already seen that it is directed backward and upward. Apart from that, on the dorsal surface you have three very important features: median, intermediate and lateral sacral crest. So first, what is median sacral crest? So in the midline plane or in the median plane, you have the median sacral crest, which actually bears the 3 to 4 spinous tubercle. So you know that every vertebrae is having the spine in midline posteriorly, and that spine of the sacral vertebrae merge with each other, and they are now known as spinous tubercles rather than the spinous process. And these represent the fused spines of upper 4 sacral vertebrae. So this is the question, that the median sacral crest consists of all the 5 sacral spines or only the 4. Answer is 4, not 5. So here you can see that this is the 1 spine tubercle, this is the 2nd spine tubercle, 3rd spine tubercle and 4th spine tubercle. And these tubercles are connected by a line, and this line is known as median sacral crest. Clear? Now this area is not having the 5th sacral spine tubercle, and that's why you have a gap in this part which is known as sacral hiatus. Clear? So that will see in the coming slide. Now apart from that, on the dorsal surface below the 4th tubercle, there is a U-shaped gap is present in the posterior wall of the sacral canal, which is known as sacral hiatus. So I just told you that this U-shaped gap is present, and this U-shaped gap is known as sacral hiatus. And why this sacral hiatus is there? Because the posterior wall of the sacral canal, there is a failure of the lamina of 5th sacral vertebrae to meet posteriorly. Clear? So what will happen? Suppose this is the vertebrae, this is the pedicle, and here you have the lamina. But these lamina fails to fuse, so the fusion is there is no fusion, so the spinous process will not appear, and this part remain opens, and this open part is known as sacral hiatus. So what is the reason of the formation of sacral hiatus? That the lamina of S5, this is again the important part, that laminas of the S5 fails to fuse with each other. That's why this part remain open, and it will lead to the formation of sacral hiatus. Now what are the other features of the dorsal surface? Now lateral to the median crest, if you will go, now this is your median crest. Now if you will go lateral to the median crest, what you will find? You have seen a typical vertebrae where just side of the spine you have the lamina posteriorly. So we are talking about this area. Now this area just on the sides of your median sacral crest is formed by the lamina. So this part is formed by the fused lamina. So this is again the question, sometimes you have the spotting or the marking on this area, and the question is that which part of a vertebrae is going to form these areas on both the side of your median sacral crest. So you have to keep this thing in mind, that this is the lamina. So this part is going to form by fusion of laminae. Clear? Now lateral to lamina, if you will go next to the lamina, now this is your superior articular process. That means here, if these vertebrae will not fuse, then you have the articular processes of adjacent sacral vertebrae. So this part is going to form or represent the fused areas of adjacent articular processes of the sacral vertebrae. So, what is this? This is the fused part of the spinous processes which are persist as a spinous tubercle. This mid area is formed by the fusion of lamina. Now, lateral to this part, you are having lateral to the lamina, and in the line of the superior articular process of S1, there are 4 articular tubercles and they represent the fused articular processes of the adjacent vertebrae, and this line is known as intermediate sacral crest. Clear? So, what is intermediate sacral crest? Intermediate sacral crest lies just lateral to the part of the sacrum which is formed by fused lamina. Or I can say that if you have this question in exam, the part of the sacral vertebrae lies between the median sacral crest and intermediate sacral crest is formed by, answer is fused laminae. Clear? And this intermediate sacral crest lies in the line of superior articular facet and it represents the fused tubercles, or you can say fused articular processes, which actually represent the articular processes of adjacent vertebrae. Clear? So, this is the important thing. It does not include the inferior articular tubercle of 5th sacral vertebrae which form the sacral cornu. Now, this is again the question, as the sacral hiatus is formed by the failure of the fusion of the lamina of S5 vertebrae. In the same way, the inferior articular processes of the S5 also remain they fails to fuse. And here you can see that these are the points, and these points are nothing but inferior articular processes of S5. And these processes of S5 are known as sacral cornu. So, what is sacral cornu and sacral hiatus? You are having the two dilated areas and a U-shaped gap. Now, this gap is known as hiatus, and these points, or you can say the two ends of this U-shaped areas are known as sacral cornu. Clear? So, what is sacral cornu? These are the inferior articular processes of S5. What are the other features of the dorsal surface? The inferior articular process of S5 is remain free and it is known as sacral cornu, which projects downwards on the both side of sacral hiatus. Now, lateral to the articular tubercle. Now, if we will go lateral to this articular tubercle line, that is known as intermediate crest, what you will find? Dorsal sacral foramina. So, lateral to the articular tubercles, there are 4 dorsal sacral foramina, and these foramina we have seen communicate with the sacral canal. Now, if you will go more lateral to the dorsal sacral foramina, you have the lateral sacral crest, and this lateral sacral crest is formed by the fusion of transverse processes which are again now known as transverse tubercle. Clear? So, here you can see that we are now talking about this area, and this area is known as lateral sacral crest. So, in these two images, you can correlate that these are the individual spines of your vertebrae, but here in the same line, if you will see the sacrum, these S1, 2, 3, 4, upper 4 will fuse each other and they are known as median sacral crest. Now, these are the joints between the adjacent articular processes, and you can see that this is the joint of L5S1. And in the same line, you have this area which is known as intermediate sacral crest. Now, here these are the transverse processes and these are the intervertebral foramina. So, intervertebral foramina divided into the parts by the fused costal and transverse element, and these tips of your transverse processes are present here, and if you will draw a line, these are known as lateral sacral crest. Clear? So, what is this area? Is median sacral crest. What is this? Intermediate sacral crest. And what is this? Is lateral sacral crest. And what is the reason of formation of this area? Answer is fused laminas of adjacent sacral vertebrae. Now we'll come to the lateral surface of the sacrum. Now when you will see the sacrum from the lateral side, now this lateral side, you know, that is having a very big auricular or L-shaped area. Now this L-shaped area is going to make a joint with the hip bone, and that is known as sacroiliac joint. So it is formed by the fused transverse processes and the costal elements of the sacral vertebrae. Now we have seen this again and again, that lateral mass is nothing but it is a fused costal and transverse process elements. It is wide above and the narrow below, that you have seen that it is a triangle, so it is wider above and narrower below. The upper wider part bears an L-shaped articular surface, which I have already discussed, and this is actually placed anteriorly, and posteriorly you are having one more rough area. So when you will see the lateral side, you will find the articular surface, and behind the articular surface there is some rough area is also present. The auricular surface is formed by the costal element, and it articulates with the hip bone to form the sacroiliac joint. The posterior roughened and pitted area is formed by the transverse elements. Clear? So in the lateral part, you can see that this is actually the costal element, this is the transverse element, and again the same concept will come, that when you are talking about the placement of a rib on the thoracic vertebrae, you always have the ribs placed anterior to your transverse process. The ribs will come here. So the transverse element is always posteriorly to the costal element. In the same way, the costal elements is again placed anteriorly, and this green color area is actually the transverse element. Clear? So you have this concept in your mind that in the thoracic region, the ribs are developed independently, so the costal element of the thoracic vertebrae are not there. But if other than the thoracic region, if I am talking about the cervical, lumbar or sacral region, you have to keep in mind that the costal element merge with their transverse processes, and they are always present as a ventral component, because the ribs are always lies ventrally or anteriorly to the transverse processes. Now what is sacral canal? So the sacral canal is formed by the fusion of the sacral vertebral foramina, which we have seen that every vertebra is having the centrally placed vertebral foramen, and that vertebral foramen of adjacent sacral vertebrae merge or fuse with each other to form the sacral canal. And the sacral canal is triangular in cross section. Inferiorly, the canal opens at the sacral hiatus, and we have seen the hiatus is formed by the non-fused laminas of S5, and laterally it communicates through the intervertebral foramina with pelvic and dorsal sacral foramina. So we have seen that this is your pelvic sacral foramina, this is dorsal sacral foramina, this is your intervertebral foramina, and these are the communication, and this is the sacral canal. Clear? So now, at the end of this session, I think it is very clear to you that how the sacrum has been divided into the different parts. What do you mean by the costal element and the transverse elements of the sacrum? What is the meaning of median, intermediate and lateral sacral crest of the sacrum? And the important thing is that how to read the sacrum in respect to the different surfaces of the sacrum. So this is all about today's session. Thank you.